Are you getting ready to take the PANRE-LA, the regular PANRE, or the PANCE, and you are wanting help to get better at answering the questions? Then this video is for you. Hi, it's Michelle with the Medicine Couch. On this channel, I bring you all things PA and NP related, and I have lots of videos about the PANRE-LA. In fact, I just finished taking the PANRE-LA myself. I'm going to go through several practice questions, and I'm going to kind of show you my thought process, and then also talk about ways you can try to rule out wrong answers. And of course, I'll be showing you resources that I'm using and then my thoughts on ChatGPT. Remember, if you like these videos, hit the subscribe button and share them with friends and colleagues. Now, when you first get ready to do some questions, definitely, and the most important thing is have two screens. One that you're taking the test on, and then one that you can search on. And there's a couple reasons you want to have two screens. One is that if you have several tabs open and you accidentally close the tab that has the test on it, if you didn't select an answer, or if the answer you selected before you did your search wasn't correct, then it's automatically going to be marked wrong. So you don't want to give up easy points. That's number one. But the other thing is that when you're searching, oftentimes you have to refer back to things in the question because these can be long scenarios, remember? So it's really hard to click back and forth between tabs. It's nice if you can look at the question on one screen and then look at the information you're getting on another screen. So first of all, I opened the SmartyPants Searchable Blueprint. By the way, if you like this resource, I offer a discount. The coupon code is in the description box down below, as well as the link to SmartyPants. Not only do I think they're great, but I like to support them because they are a PA owned and run business as well. Now, both the SmartyPants and the Hippo Searchable Blueprints, I'm sure, are very similar because they both rely on the NCCPA blueprint, which not only lays out what topics are going to be potentially on the test, but also to the depth of knowledge that you need to know them. So these blueprints have done a good job of consolidating just that information you need to know. And of course, they're searchable, so it makes it easier. So you can also use Google and ChatGPT, and I'll show you some of those examples as we go along, and some of the issues with using those at times. And if you're somebody that does want to do a review course for the PANRE or the PANRE-LA, or even for the PANCE, I highly recommend CME for Life's courses. I think they are awesome. John Belinsky is an amazing teacher, and he really helps you understand the material and not just memorize things. So I'll also have a link to them down below and the discount code. So I have SmartyPants open, so I'll go here to the members section and I will go to the interactive blueprints. And you open it up and you scroll down here and you'll see here is the list of all the different systems. You can click on a system to go right to it, or you can just scroll down. See, as you keep going, there's cardiovascular system right there. And then all the different conditions that are contained within that topic. If you open a question, it says it's an endocrine. I right click here and open endocrine in another tab just to make it easy for the next question. I don't have to go back to the main thing. It's right there. So I have endocrine open. Oftentimes I'll just read through these different topics to get my brain kind of thinking and familiar with what may be covered in that section. I don't spend any time studying really before I take the questions, but you're more than welcome to if you want. The other thing that I have open is this PANRE-LA Smart Search. I think this is kind of unique to SmartyPants. They have two ways you can search. One, this rapid search will search the entire blueprint. Or right above each system, there is a system-specific search, which is only going to search in that particular topic, which is handy because there are some symptoms and things that are obviously going to show up in different conditions across multiple systems, but this is only going to search for those within that system, which is what you want, it more narrow. And then I'll also just open a plain Google tab because these blueprints are not going to have everything you need. Sometimes it's just the way the question is worded or something unusual that they're looking for that may not be covered in the blueprint. So I do supplement with Google from time to time. So I'll have that open. Now, the other very important thing to have open is the lab values sheet. It's much easier to either have it printed out or have it open when you're getting ready to take the test. That way you don't have to scramble to try to find it. It is there in the test, but sometimes it's hard to find. So if you just Google NCCPA lab value sheet, it'll come up right here. So like this one has blood, plasma, and serum test first. They're all in alphabetical order. And then you go down there, cerebral spinal fluid, synovial fluid, hematologic, sweat, and urine. So, and then within each section, they're listed alphabetically. Be a little familiar with that so you don't have to read through every single line. You kind of know where you're going on this resource. And I would say the same thing if you're using a searchable blueprint or up to date, whatever you're using, make sure that you're very familiar with it and you practice searching in it several times so you kind of get a hang of that. Now we're going to pretend that we are opening up a question. And by the way, these sample questions that I'm using all did come from the NCCPA website. They're not any of the current questions or anything. I'm just using what they have publicly available. I think the first thing you should do when you approach a question is not just start reading the question. The first thing you should do is go to like the last line or wherever you see the question mark and read what it is that they're looking for. Now, the reason you want to do this is you want to prime your brain to be paying attention to what it needs to pay attention to in the question. I mean, how many times have you read a whole paragraph and you're like, I don't even know what I read? But if you're looking for something specific when you read that paragraph, I bet you would remember more. So that's kind of what we want to tap into. You want that subconscious and that brain thinking as you're reading the question. And this is how I read the question. So first I look down here and it says, which of the following is the most likely diagnosis? Okay, cool. That's a straightforward one. It's just looking for what the diagnosis is. Okay, so when we look at this, it says a 22-year-old woman, gravida 0, para 0, comes to the office because she has been unable to conceive despite discontinuation of oral contraceptives 1 year ago. Okay, when I read that, or when I read anything that has numbers in it, my brain just kind of zones over those numbers. They mean nothing to me. So part of what you have to do, and we'll have more examples of this as we go through the question, is to reframe those numbers into meaningful data. And I'm going to be picking this apart. It's not going to be this hard. It's not going to take you this long what I'm about to show you, but I'm just trying to tell you how I think. So the first thing I know is we've got a young woman, she can't conceive. So that's what the problem is. So the gravida 0, the para 0, even if they were other numbers like 3 and 2, I would just generalize that like, oh, she's a woman, she's never given birth, or she's a woman and she's had several miscarriages, or she's a woman and she's had lots of kids, something like that, just so my brain is already kind of understanding the scenario a little bit. Then it says the patient has had only 2 menstrual periods during the past 10 months. Menarche occurred at 14 years of age. What is that saying? It's basically just saying she's having scant, spotty periods, but we know she had periods before because she started at 14. And then it gets into more of those numbers. Height is 5'6", weight 200 pounds. Vital signs are within normal limits. She's kind of average height, 200 pounds. She's a little on the heavy side, and her vital signs are normal. So we're kind of ruling out anything that's really emergent or worried she's about to go over the cliff. She's fine. She's just having this problem conceiving. Then it says on physical exam, you have velvety, verrucous, hyperpigmented lesions on the nuchal area, as well as excess hair on the chin and acne in the cheeks and back. Breast and pelvic exams show no abnormalities. So right there, they told you some very specific information, and they have to in these scenarios to get you to the right place. So if that's what they chose to highlight, that's going to be like probably the most important information in the scenario. Because I summarized that in my head, basically, it makes it so much easier. I just got a young woman having trouble conceiving. We know she's had periods in the past, but been having problems with her periods lately. Her vitals are normal. She's stable, but she's kind of overweight. And then she's got these velvety patches on the back of her neck, and she's got this hair growing on her chin. So in doing that, before you've even looked at the answers, you might have some bells and whistles going off and having some ideas. Next, you can look at the answers then. Think about each one for just a second and think about any that might not make sense. PID, pelvic inflammatory disease, you're going to expect some pain going on. There was no pain in that scenario. Her pelvic exam was normal. She's got no fever or increased heart rate that would make you think that she's in some kind of distress or having problems. So pretty much that one you can throw out the window right there. The next tip is to look at what system you're in. You're being tested specifically over the reproductive system. Is the answer likely to be an endocrine answer like Cushing's or hypothyroidism, even primary adrenal insufficiency? Not likely. I'm not saying it's impossible, but you can pretty much throw those out if they're not a condition that's in the reproductive system. So right now, we haven't even looked up anything, and we've ruled everything out except for polycystic ovary syndrome. Now, they're not always going to be this easy and be able to rule out that many, but that's a great example of showing you how spending just a few minutes evaluating if any of these other answers could be right, and if not, then throwing them out, that really just narrows things down for you. So at this point, we're thinking it's polycystic ovary syndrome, and you go to the blueprint here. Things aren't always going to be listed exactly as they're listed on the test or in the question. So you might have to look through this a little bit and say, oh, ovarian cyst, polycystic ovary syndrome, probably underneath there. So you click on ovarian cyst. And when you come to the blueprint, at least in Smarty Pants, they're going to give you a presentation. Sometimes they'll have a picture or a video there. I'll show you some of those later, and people get confused and it's like, oh, I don't want to watch a video. You don't have to watch the video or anything. Just go down below that and you'll see this presentation. What this is doing is it's highlighting all of those buzzwords. They're going to have to put some combination of these buzzwords in the test question in order to get you to the right diagnosis. So oftentimes you can easily compare things here. Now this one is a little different in the presentation. They're mostly talking about like single ovarian cysts and things. But if you click over here to pearls and kind of read through here, and you can scan this stuff, pretty quickly. And they're going to put stuff that's important or that you need to pay attention to in bold or different colors. Of course, if it's in blue here, then it's got a link to it. So you can click on that. And this is where I'm talking about. Sometimes you'll get this video pop up. But then if you look down here, it's going to give you those buzzwords that we were looking for. Her periods are irregular here. She has hair growth on her chin, acne. Then you go here to pearls. And it's going to be more information. It's going to give you the pearls, the main things you need to know about this syndrome. And if you notice, if you look through here, it doesn't specifically mention the acanthus nigricans, which is what that velvety discoloration on the back of her neck was. But you don't have to have that. You don't have to match everything exactly. If there's enough things, if they're painting the same picture that their scenario had painted and it's one of the answers and you're looking at it, that's enough. You don't have to have 100% confirmation. But if you wanted to, you could then Google polycystic ovary syndrome. So if you aren't using the blueprint, if you just Google this is what comes up. And it shows you the symptoms: regular periods, hair on the face, acne, weight gain. We talked about her being heavy, darkening of the skin, especially around the neck. So right there, you can see that this matches up with your answer. And then I told you I'd show you what ChatGPT or any AI service that you use. So if you put in polycystic ovarian syndrome, you're going to get a lot of stuff here. You have to kind of look through it. Common symptoms: irregular cycles, excessive androgen, facial hair, infertility, weight gain. And of course, you don't have to do this, but I also pretty much looked up every question, even if I was 95% sure of it. There were times when I was tired and I was just like, whatever, and I was pretty sure and I just put in the answer. But I always double checked myself just because I want to make sure I pass on the first time. And it's not that hard just to double check. But one of the things I didn't mention that's really important is once you read the question and you kind of read through the answers, try to have a gut reaction to pick one answer and then go ahead and choose that on your test. Clicking it does not mean that you're locked into that answer. It just puts an answer in there. That way, if the internet disconnects, if you accidentally close the tab, if you time out before you went back and put the right answer in, you at least have a shot to get it right. And now let's go on to this next scenario. This tells me that it's coming from the EENT section. So I'm going to open up here the blueprint for the ENT section. Again, if you wanted to, you can kind of familiarize yourself with the topics in this one. It's kind of a big one, so I probably wouldn't. Then you're going to have your rapid search open, ready to look at the question now. What's the first thing I'm going to do? We'll look at what they're looking for. I look at the last sentence. This one says, which of the following findings is most likely on fundoscopy in this patient? So we're looking for a physical exam finding. That means that you're going to have to tell us what the diagnosis is, or we're going to have to figure out what the diagnosis is based on the symptoms, and then figure out what exam findings we would have of them. So this says a 40-year-old man who has type 1 diabetes comes to the office for follow-up examination 3 weeks after proliferative diabetic retinopathy was diagnosed. So they're giving us the diagnosis here. He has no other chronic disease conditions. Which of the following findings is most likely on fundoscopy? This is thankfully a very short scenario, so you really wouldn't have to read the last question first, but it's a good habit to get into every question you come to. So we got a middle-aged man. He's got type 1 diabetes. They were very specific about what type of diabetes it is. So that's probably going to be important. And he was just diagnosed with proliferative diabetic retinopathy. They didn't just say he's a diabetic that has retinopathy. They're giving you specific stuff. He's a type 1 diabetic and he has proliferative diabetic retinopathy. What are you going to see on the exam? So you look at the answers really quick. Okay, those are all things you see in the eyes. It could be any of those things. They're all in the category, right? EENT, so there's nothing I can throw out there. Then you pick an answer that you think might be the right one. Then I need to figure out what the symptoms of proliferative diabetic retinopathy or the physical exam findings are for that. So I look in the blueprint, the searchable blueprint. I'm already in EENT. And I scroll down and I see that there is a retinopathy, diabetic, and hypertensive. So this is diabetic. So I click in there and they're going to give me a couple scenarios. I don't have to spend time reading these scenarios because I already know what the diagnosis is. And the presentation is really to help you figure out the diagnosis. Now, it may have some of the exam findings here, but I prefer to go over to the pearls. And so I look through this and I'm looking for things that might give me the right answer, right? So this is telling me kind of the causes of it. And then it's got diabetic retinopathy, which is what we want. And I skim through here. I usually try to look at the bold words first instead of reading everything. And here I see non-proliferative, and then there's the proliferative. And so that's telling me it has all the above, all these symptoms plus neovascularization. So it's got cotton wool spots, flame hemorrhages, hard exudates, and neovascularization. I look over here and I'm looking for any of these words to match. I see there's neovascularization. Okay, so now I'm going to reset for the next question. So we open the cardiovascular system because that's what we're going to be tested over. Let's look at this next question. What are they looking for here? And it says, on the basis of this patient's history and symptoms, which of the following pathological processes is most likely to have occurred first? That's not something that I see them ask very often, but this is a great example of how they can kind of use one scenario to get to something else. So if you had read that whole scenario and you didn't know that that's what they were looking at, your brain might have been thinking about all kinds of other stuff. But now that we've read the question, we know that they're asking for a pathological process. So we have to figure out what the diagnosis is, right? To understand what the pathological process is. So then we read it. It says a 55-year-old man comes to the emergency department because he has pressure-like pain in the substernal region of his chest the past 20 minutes. Patient says the pain radiates to his left arm. He's nauseated, sweating profusely. Medical history indicates long-standing hypertension that is well controlled with diuretics. On the basis of this, what is the pathological process that may have occurred first? When you read that scenario, without even going back and summarizing, it seems pretty straightforward that it's like a heart attack or angina at the least, right? You have a middle-aged man, he's got substernal chest pain radiating to his left arm, nauseated and sweating. Could they paint any clearer picture that we're talking about a heart attack here? And then they want to know what the pathological process is. And you may be like, what do they mean by that? So then now I would look at the answers and I would try not to panic and think, oh God, I do not remember the clotting cascade. But what that tells you is that you're dealing with the clotting cascade, right? They're trying to find out if you know how clots form. Now I could take a chance and look here under the MIs in this blueprint and see if they're going to, in the pearls part, going to tell me like how a heart attack forms. But honestly, especially once you get familiar with these resources, you'll understand that they can't put everything in there. And they can't go back and do like fundamentals and everything. You'd have too much stuff to read. So this is where I would just jump to Google right away and say, how do clots form? Because honestly, I don't remember what happens first. Somewhere you're going to find the steps of clotting. And it says that there's chemical systems that happen first, platelets attach, then clotting factors come in, and then there's healing. Well, it's already telling me that platelets attach come before the clotting factors. So these first three, A through C, can be out. And then there's conversion of fibrogen to fibrin. It doesn't say that, but it does say right here, like it causes strands of fibrin to stick together and form a mesh. But if you're still not sure that that fibrogen to fibrin is what they're talking about that comes later, you could spend, if you have the time still, to look through and convince yourself and make sure you're 100% sure of the answer. Now, I did ahead of time scroll through and look at some of these things, and most of these are talking about just blood clots and how they form for patients and getting people that kind of information. So you might want to Google something like exact steps of the clotting cascade or clotting process. You're looking for a teaching site, this is going to tell you the exact steps. And let's look at another question here. And this one is in infectious disease. So I'm going to right click and open infectious disease. I still got my search ready and I need to open a new Google. We're going to find out what they're looking for first. So it says, on the basis of this patient's history and symptoms, initiation of therapy with which of the following medications is most appropriate. So we're looking for what medication? So it says a 74-year-old woman who completed therapy for herpes zoster 5 months ago comes to the office because she had continued burning pain in the area where the rash had been located. The patient says she has tried taking acetaminophen, but it's not effective for pain relief. Otherwise healthy. Physical exam shows resolution of the rash, no vesicles or lesions present. On the basis of the patient's history and symptoms, initiation of therapy of which of the following medications is most appropriate. So it's an older woman and she had herpes zoster and she had this rash with it. But that was 5 months ago. The rash is gone. All the lesions are gone. But now she's having some lingering pain, bad enough that Tylenol or acetaminophen is not touching it. So they're not asking what the initial treatment of herpes zoster is. They want to know if you know what happens if the pain from herpes zoster doesn't resolve. Now, it's a good chance you know that herpes zoster means shingles and that the shingles has resolved, and this is post-herpetic neuralgia we're talking about. But if you don't remember that, I know some people work in specialties or whatever, and they just haven't come across this in a long time, and it's not popping to their brain. That's fine. We can still pull out things to search for, and I'll show you that in a minute. We've got the scenario. We know they're looking for medications. So let's look through the medications. Acyclovir, amantadine, fluoxetine, gabapentin, and prednisone. So you may be very familiar with some of these medications. If you're like in psych and you see that fluoxetine, you're like, we've never heard of that being used for shingles. So you can automatically probably eliminate a few medications there. The fluoxetine, probably the amantadine. And then maybe you've got acyclovir, gabapentin, and prednisone left. You think it could be any of them. Just pick one at this point. Don't spend a lot of time on it if you don't have any gut feeling one way or the other, and then go look in your sources. So you look in infectious disease here in the blueprint, they're going to have it listed by the major topics. Post-herpetic neuralgia is probably not going to be the major topic. It's probably going to be under herpes zoster. So you look through the list here alphabetically. Here's herpes simplex. You're like, I'm not sure if it's that because it's not really simplex. You can keep reading through and then you see this varicella zoster. So I'm going to click on the herpes zoster. And again, this real diagnosis things comes up. When you're taking the test, you don't have time to watch that. Don't worry about it. Just look down below if you're needing this scenario to make sure you're in the right place. It's going to have chickenpox here, and if you go down, it's got the herpes zoster here, the shingles. We already know what it is. That's not really what we're looking for. We're looking for treatment. So I'm just going to skip all the way over here to treatment. And then again, it starts with chickenpox. I don't want that. And then there's this zoster here, shingles. This is what I want. So it says acyclovir given within 72 hours. Nice big bold print. I'm like, oh, okay, well that acyclovir 72 hours. This is 5 months down the road. That's probably not going to be it. Here we have post-herpetic neuralgia. So it's giving us a different treatment than up here. And this is saying gabapentin and tricyclic antidepressants. are the big ones in bold. Well, you have gabapentin here, and there's gabapentin there. I would just match with that and go on. But if you're like, oh, I can't remember if fluoxetine or amantadine is a tricyclic antidepressant, you could then Google those, or you can use Hippocrates. A lot of times when it's medication related, I need specific stuff about medications, I'll pull up my phone with the Hippocrates app on it. So remember, as soon as you see something that may indicate that the answer you preliminary chose is wrong, I would go back and choose whichever one you're thinking is now the right answer, and then spend a little bit further time verifying that that is the right answer. Always try to update your answer as information comes in. And you do as much as this as you can in the 5 minutes. Time kind of goes by fast, but if you have a stepwise approach and order you're looking at these questions in, you can get most of them searched and an answer found in 5 minutes. Now, if you went to ChatGPT and you didn't know it was postherpetic neuralgia, and all you have to work with is herpes zoster treatment, and you put that into ChatGPT, then it's going to come up with the symptoms, and then it's going to give you treatment, antiviral medications, acyclovir, and so on. It does say that you need to start those within 72 hours, but you're faced with all this other stuff you have to read to see if there's any exceptions to that. And so you may be tempted, like, oh, there's acyclovir. This is saying acyclovir. You may be tempted to go and pick that answer without spending the time, or maybe you don't have the time to read through all of this, because postherpetic neuralgia doesn't show up until you go down here through complications. Then you have to read this whole paragraph. Nothing's bolded and highlighted for you. And then it says additional pain medications like gabapentin or tricyclic antidepressants may be used. And most of the time they're right, but not always. ChatGPT or other AI sources have been shown to kind of fabricate information from time to time, even if they can show you a list of references to back it up. So there's always that you have to be a little concerned about. I just don't really feel comfortable using ChatGPT in a test type situation, but that's up to you. To use a regular Google search, you could put in herpes zoster treatment. This will come up, that oral antiviral therapy like acyclovir or whatever in the first 72 hours. Then it does a pretty good job of putting postherpetic neuralgia pretty close. Tricyclics can be considered. Other treatments include blah, 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 plus oral gabapentin. That's not quite as straightforward, but it is there. This is an example why I think the blueprints are just better to use, because they're putting the information in a way that they know that what the test is looking for. They know some of the buzzwords that are going to be used. They know what needs to be highlighted and what you're searching for. So generally, it makes it easier. So let's look at a question here that's got a lot of lab values, because sometimes that can really freak you out when you've got this long scenario and you've got all these lab values and you're like, oh, how do I get through this quickly so I can start searching if I don't know the answer? So we're going to do the same thing. You're going to go all the way to the bottom. Which of the following is the most likely diagnosis? Now we're going to read through the question and we're going to conceptualize things as we read. 41-year-old woman has a 9-month history of nausea, constipation, dyspepsia, general fatigue, arthralgia, and increased memory loss. She has no history of illness other than her present complaints, and her menses have been regular. Physical exam shows no abnormalities. Lab findings include the following levels. So before I go looking through the labs, I just kind of summarize that in my head. So we've got kind of a middle-aged woman, doesn't have a whole lot of health complaints in general, but she's got these more kind of vague complaints: nausea, constipation, dyspepsia, fatigue, arthralgias. I mean, that can be lots of different things, right? She does have increased memory loss. That's a little bit more specific, but these other ones could pertain to like a million different diagnoses, right? So it's hard to kind of hone in on things at this point. But if there was something very specific, I'd make sure I'd had those pulled out in my head. So now you want to figure out which labs are normal or abnormal. Many people have been frustrated and ask, why can't NCCPA put the normal lab value ranges right next to these labs, which is what we have in real life, right? When you get a lab report, it usually always has the normal lab values right next to it. But they've chosen not to do that. So this is where it's handy to have that lab value sheet already open and ready, because all we're trying to identify right now is which ones are normal and which ones are abnormal. So albumin, it's not here under albumin, but it's a protein. So we come down here to the P's. Here, albumin, we see 4.9, that's in the normal range. Calcium, come back up here. Calcium, is 13 and normal cutoff is 10.2. So like, oh, our calcium is high. Okay, chloride is right underneath it. Chloride's a little high. And now we look at creatinine, that's normal. Phosphate here is super low. They're at 0.3 and this starts at 3, so super, super low. The other ones are a little high, but that is super abnormal. And then the BUN, you see that that's normal. Okay, so we have mildly high calcium chloride and significantly low phosphate. Well, before we get to the search, let's look at the answers again. Remember, look through the answers a little bit and remember what system you're in. So we're in endocrine. So the choices are Cushing's syndrome, hyperparathyroidism, hypopituitarism, malabsorption, and multiple myeloma. Are there any that you can throw out? Well, multiple myeloma, that's not endocrine. That would be in hematologic, blood cancers. So you can get rid of that one. And malabsorption, really, that's probably would be under the GI/nutrition topic, right? So you can pretty much put that one to the side. You've narrowed it down to 3 out of the 5. You just pick one, even if you have no clue, just pick one to get something in there. You have a 1 in 3 chance, and then go do your searching. So at this point, let's say you have no idea what to search under because you have all these non-specific symptoms really, and you don't know what this constellation of symptoms together means. And so you don't even really know how to start searching. Now you could search by each individual condition and see what it says, but that's going to take a long time, right? Well, remember that there's the search function. So we're going to search an endocrine here, and I'm going to put high calcium and low phosphate. That one was really unusual. And I hit search, and it takes you to this. Now there's 2 conditions that pop up, hyperparathyroidism and hypoparathyroidism. So automatically right there, before you even read anything else, especially if you're running out of time, if these are the things that match the search, I would go change my answer right now to hyperparathyroidism because at least that's something. I've seen something that's told me that that might be the right answer. So change that really quick. Again, while you have 2 screens open, and then you can click on this and you can look for more specific stuff. And so here's where that presentation can come in handy. It's saying that older age female, joint pain, general fatigue. It doesn't say anything about the memory loss or those kinds of things, although it does say psychic moans, so possibly. But if you go in here to pearls, you're going to get some more information, right? And it's going to tell you the symptoms usually begin after the calcium rises above 12, and she's at 13. So that's fitting with it. Patients may complain of nausea, vomiting, weakness, fatigue, constipation. Like, yes, that's hitting, the things that you saw there. As the levels rise, they may become confused and lethargic. So that's mental stuff going on there. So it's hitting a lot of things. You could be pretty convinced there. But if you need more convincing, you can kind of skim through here. Again, it's all in one place. This is pretty quick to run through. You're skimming, you're looking for those keywords. And then all of a sudden you see this chart and it's like, oh, okay, so serum calcium was going to be high, but phosphate's going to be low. Well, that's exactly what she has. For me, that would definitely be enough. I'd stop there if you hadn't already and chose that answer and move on. So I want to look at one more because this is kind of some of those ones that can be tricky. It says we're in GI nutrition. So I open that system. I've still got my searches ready to go. So we start off by reading what they're looking for. They want to know which of the following is the most appropriate next step. We hate these most appropriate ones, right? Because a lot of times we're thinking like, especially if you work in ER or something, what the steps are that you would do in your particular setting, what they want you to do, what the protocols are. There's so many things that come into play as far as what the next step is that it's not always that easy. So be prepared. We're going to have to reason through this a little bit. We have a previously healthy 15-month-old boy became anxious and crying and drooling copiously. A few minutes before that, he had calmly been playing with his toys. There's a reason that they're telling you the kid's playing with the toys. They're not just putting stuff in to make extra time for you to read. Most everything in the question is going to be important. So what was the child doing before that? He was fine. He was playing with toys. So this is telling us this is an acute something that happened, probably connected to what activity he was doing. Temperature is 98.1. Pulse is 84, respirations are 18, so nothing there is really jumping out as being terribly out of whack. On physical exam, the posterior pharynx is mildly injected, but otherwise clear. Lungs are clear. Findings on chest x-ray are normal. Within an hour, he's calmer, but he continues to drool heavily. Which of the following is the most appropriate next step? They're painting a picture here, right? A healthy kid, something happens to him. He becomes agitated, he's drooling, they bring him in. Everything seems pretty normal in exam, maybe a little redness in the back of his throat, but nothing is jumping out at you specifically. But he's still drooling. So they're telling you that there's still some problem going on. So we have to figure out what is going on. So let's look at the answers here. Administration of syrup of ipecac, barium swallow study, chest physiotherapy, a scope, and then insertion of a nasogastric tube. And remember, we're in GI nutrition. So chest physiotherapy, is that really something that's going to be the answer when we're in GI nutrition? That's probably not likely. So you've kind of ruled out chest physiotherapy, and you've got these 4 other answers that all seem to have something to do with the GI tract from the mouth down to the stomach. And so you should automatically, if you weren't already, be thinking that maybe this child swallowed a foreign body. So you've already got the blueprint pulled up for this category, and you go down here and here's foreign body ingestion. You click on this, it brings up that scenario. A young kid generally appears well. Ingestion happened less than 30 minutes ago. So that kind of all fits. And then you have foreign body or toxic substance. Most likely a foreign body because he was playing with toys. Could have been toxic, but foreign body is probably it. So we'll check that first. This says ingestions are often unwitnessed, so that's probably what happened. Majority will pass spontaneously. However, complications can occur. When we come down here to esophageal foreign body, remember we kind of were clued in that it was had something to do with the esophagus or lower because of the answer choices. So here it says when symptoms may be present, that may include bloody saliva, coughing, drooling, dysphagia, those kinds of things. So we've got that drooling that matches our scenario. Once it passes the esophagus, typically pass by the increased risk of complications. Remember, the question was which of the following is the appropriate next step? So we're looking for next steps. Here's bronchoscopy, but we've already said that it's not, we don't think it's been inhaled, we think it's been swallowed. So here is the part about if it's thought to be in the esophagus. And if the object causes symptoms or the time point of ingestion is unknown, attempt immediate endoscopic removal. Typically, radiopaque objects, such as small toy parts, will be seen on x-ray. So if it was a chest x-ray from the diaphragm up that they told you was normal, that again shows us it's probably in the GI system further down. And this is telling you if symptomatic and distal to the esophagus, then remove immediately with endoscopy. So that would put me over here to the esophagogastroduodenoscopy. The next best appropriate steps are going to be probably the worst questions you're going to have on the exam. Just try to always remember that they're going to want the most common choice. They're going to want what you would do for the majority of things in the majority of cases. And even then, you may get those wrong. There's a lot of people who complain about them. It's a good chance that those questions won't count anyway. They'll either be removed or replaced. And if you don't know what those are, then there's a card here to a video I did about what the removed and replaced items are. But the point is, just don't stress too much. Do your best to narrow it down, find the right answer, verify to yourself that you have the right answer, choose it, and move on. I will have links down below and the discount code to Smarty Pants and CME for Life's courses, and have links to some of the other print materials that people would like to use. Now, if you're about to start the PANRE-LA and you want to see more test taking tips or want just more information about what the test is going to be like, you're probably going to want to check out this video here. Thanks for joining me. As always, take care, stay sane, and I'll see you next time on the medicine couch. Bye. Esophagogastroduodenoscopy. Esophagogastroduodenoscopy, I think. Scope.